Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Welcome to another episode of Empowering Plans. This is Kelly Dempsey, and I have Kevin Brady with me coming to you again to talk about COVID. And the reason why we picked this topic is, and it's definitely not intended to be political in nature, but if you have heard any of the stories or watched 60 Minutes interview that happened with President Biden this past weekend, you will know that there are some conflicting opinions regarding the statements that were made during that 60 Minutes interview with President Biden. So again, we are not attempting to be political. We're not, poking fun or, discussing that piece of it. It's really just to focus on what are the rules right now and what plan language is needed to support those rules and, what rules are still in place, because it's a constant ever-changing universe that we live in. So if you did not hear it, President Biden said in his 60-minute interview when they aired it on Sunday night, I believe, that he, quote unquote, said the pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it, but the pandemic is over. And that has been a pretty controversial statement, which is one of the reasons why Kevin and I wanted to talk about it today. It's possible that President Biden was actually talking about the shift in society with the greater access to vaccines and the increase in travel and reduced mask use. But making a statement like that can be confusing because there really isn't a change in the rules yet. There has not been official changes in the rules. So with that, I'll kick it over to Kevin to kind of kick off this concept of, is the pandemic really over?
Right. Yeah, exactly. And you make a lot of good points there. So, yeah, I think, anytime you have a comment like that, obviously coming from the President of the United States, people make assumptions and kind of can go from there. So, one thing that, really came out of this was just, a lot of people, whether they be medical experts or, pundits or whatever it might be, kind of coming back and saying, hold on, let's hold the phone. Let's not get ahead of ourselves here. Maybe there's a kind of a long way to go, right? So definitely possible that, he wasn't, making any broad statements about changes in legislation or regulation or anything like that. But like I said, anytime, POTUS, the president's making some kind of statement, people are going to read into that. So I think it's just really important that, we kind of take the time to think through what the current situation is, regarding the pandemic. What are the rules in place? Would the pandemic be, as it relates to, group health plans and those requirements and everything like that. But yeah, just to kind of contextualize and provide a little bit more, background, I think generally the major, medical experts in the field have kind of just pushed back on the idea that the pandemic is over. And there's a lot of different reasons for that. But, one thing that really stuck out to me was just that at some point, the idea is that we want to be able to simply, live with the virus, live our daily normal lives. And we're just not there yet. And there's a lot of factual background to support that coming from some of the things that Kelly's going to talk about. But that's really coming into play because, living with the virus is kind of, the standard that's at play now, right? I don't think from a medical perspective or, just pathology, whatever it might be, that we are in a position to, eradicate, COVID completely. So it's going to play a part in our lives. I guess the idea here is trying to determine, when will the pandemic be over and when is it simply going to be part of our lives, kind of maybe in the background or something like that. But, generally, I wouldn't say a consensus because obviously there's a lot of differing opinions on this, but a lot of highly educated medical experts in the field have kind of pushed back on that idea. And just to provide a little bit more context on the current situation, kind of what's going on pandemic related before we jump into the real nitty gritty kind of, rules and regulations and how that impacts group health plans, I'll throw it back over to Kelly just to kind of go through some of those important topics.
Yeah, Kevin, you're right that this whole situation about is the pandemic over is really, I think the concept is that if the administration and our leaders come out and say it's over, are people going to revert back to old life? I mean, we have to accept that life as we know it is forever changed. And the way that we live and operate is always going to be different. And I think that's one of the biggest fears here about the statements that were made is that it's going to change how people react and act. And, I can personally say that I was always a fan of the concept of wearing masks when you are sick. If you can't tell right now or, don't hear my voice on a regular basis, I have something going on. It's not COVID. It's not strep. I was tested for both. But, I had a couple errands to run yesterday, and out of respect for people around me, I wore a mask when I was shopping yesterday. And I think that we don't live like other societies, that there are other, places where that is the norm for them, and it has never been the norm in the United States. And I think people are just afraid, and the medical professionals are just afraid that if we say it's over, that people are going to, act in a different way. But anyway, so the next concept is kind of long COVID. And this is obviously something that I'm very passionate about because I do have a very dear friend that got diagnosed with COVID in October of 2020. I've used her story as kind of my muse for articles and podcasts and other things that I've done, even some blogs. So the concept of long COVID is very close to my heart because I have a friend who was literally one of the most healthiest, fit people I've ever known in my entire life. She was an athletic trainer. That's kind of what she studied in college. She was doing home health care when she was exposed to COVID and was diagnosed officially in like September of 2020. And now we are in September of 2022. So a full 2 years later, she still cannot smell or taste. She cannot, function as a normal adult. She's got so many side effects that I don't want to make this about her specifically, but it's a debilitating situation. She's not able to return to her full-time work. And I don't know if she ever will because of these long-lasting side effects that she has. And she's not alone. There's about 16 million Americans that are potentially suffering with long COVID. The stats really are very general because we don't really know. And there's not really a definition specifically for long COVID, at least from a medical perspective. And there's reports saying that at any given point in time right now, there's between 2 and 4 million people out of work based on lingering COVID symptoms. And that's a terrifying statistic, in my opinion. And it's just, the level of which people recover is so very different from a person to person basis. So I think, again, the magnitude of this concept of long COVID is very different than what most people have ever realized. And again, we're only really 2.5 years into this 100-year pandemic situation that, when does it change from a pandemic to an endemic, things of that nature. I'm not a medical professional, so I can't speak to that, but this definitely has the potential to change a lot of what we still deal with on a daily basis. And I think in addition to long COVID, whether or not it's going to be a disability, whether or not it's eventually going to rise to the level of ADA accommodations or even Social Security disability. There are individuals that get disability for other debilitating situations like long-term effects of a heart attack, if they're never going to regain that heart function because of the severity of their initial, issue. Those that have COVID aren't at that level yet. It's still being very debated because it's still new. So even though it's been around for 2 years, it's still new. So, it's one of those things, again, it's going to continue to develop. And there's some more startling stats that, again, I'm not trying to scare everyone, but I just want people to be aware of what's happening, that there's still statements and data showing that about 400 people in the United States die every day from COVID, which is still a pretty high number. And that, again, we're still at 50 to 60,000 cases per day. It really hasn't reduced, significantly in quite a while. So the death toll that's happening is effectively equal to 3 different flu seasons combined together. So, again, Kevin talked about the fact that COVID is effectively going to be like a flu virus. Medical experts think that it's going to kind of flare up in the fall and in the winter because of the weather, similar to the flu. So it's effectively something that we're gonna have to deal with like the flu, but the death rate is still very high. So it's not over. There's still a lot to be done. There's still a lot that needs to happen and discussions that need to happen. And it's one of those things that it's not really changing the way that health plans are administering the benefits as well. And the fact that there are still those rules and regulations. And that's something that we're going to start diving into. So I'm going to turn it back over to Kevin to talk a little bit more about that stuff and kind of set the stage to go over the public health emergency versus the national emergency, because those are the things that really dictate what rules we have to follow and what's still in play right now.
Yeah, absolutely. So yeah, we can talk about just, what Biden said and going toward, whether the pandemic's over, but really we do have a couple, really tangible things that we can look at to kind of think about it from a group health plan perspective, right? So the 2 big things are the public health emergency and the national emergency. And to be honest, when everything was first coming out, these kind of confused me and kind of the differences here and, making references in different, legislature and stuff like that, making the references to one or the other and trying to figure out, exactly what happens if or when either of these are expired or when they do expire. So, what we'll do is we'll kind of just go over what they are, both the public health emergency and the national emergency, and give a little bit of a high level just overview on kind of what impact that might have from a group health plan perspective. So first off, we could just talk about the public health emergency. Public health emergency is something that was initially declared by HHS, so Department of Health and Human Services, and that was all the way back in January 2020. And this is something that's renewed in 90-day increments. So it lasts for 90 days, and then there's either a renewal or it's going to expire at that time. So, dating all the way back to 2020 in 90-day increments, it's been renewed every time. So the current status is that the public health emergency is slated to end in mid-October. Obviously, it's only a couple weeks away. But, kind of reading between the lines a little bit here, the White House is committed to providing 60 days prior notice before any kind of expiration. So, thinking about the fact that we're at the end of September, mid-October is right around the corner here, and we haven't heard anything to the contrary. It does seem like the PHE is going to be extended again, but that'll just be for another 90 days, and that'll be from that mid-October date. So looking at, 90 days beyond that mid-October date, and obviously, over the course of the next, kind of renewal period, that's kind of when the experts are looking at things and making that determination. And then we'll have a better idea, every 90 days, just kind of continue to look at it and think about it and kind of see, where we're at as a country and whether that needs to continue or not. So
that advance notice, Kevin, is obviously crucial because it gives plans and employers the ability to adjust. I mean, we need time to update all these plan documents that have all this language related to the COVID timeframes and things of that nature. So advance notice is obviously preferred when it comes to rule changes so that we have time to adjust and rebound accordingly, right?
Yep, absolutely. And just going into kind of what those changes are and what impacts that would have. So the group health plan related things that are, specifically tied to the PHE, so the public health emergency, it's going to be, COVID-19 testing. So that's, coming out of the FFCRA and the CARES Act. And that's just to cover COVID-19 testing with no cost sharing, no medical management techniques, that kind of stuff. We've also got the, over-the-counter testing that's required under the Biden rule. That was, I think, back in January now. And that's, to cover a certain number of, tests per participant, and then, potentially limit the reimbursement rate under certain safe harbors. But either way, the requirement to cover those OTC COVID tests, and then also vaccines as well. Covering the COVID-19 vaccine with no cost sharing, those are all directly tied to the public health emergency. So if that public health emergency were to expire, or when it does expire, that's when those mandates will no longer be in effect. So obviously groups have the discretion to continue to cover those things. They can cover them as if, the public health emergency were still in effect, but it's just important to note that the requirement's no longer there. So that's when group health plans will be able to make that decision on whether they want to continue to cover those things at whatever levels that would be appropriate for them. So definitely something that's important, and it's going to be a decision for plan administrators, and then potentially, making plan changes to account for those updated requirements. And then shifting gears from the public health emergency to the national emergency. So rather than being declared by HHS, the national emergency is declared by the president. And this was something that President Trump initially declared back in March of 2020. And the interesting thing about the national emergency, it's not a 90-day period or anything like that. It's annual, but it could also be terminated at any time by the president or by joint resolution of Congress. So really, this is something that could really be terminated at any time unless it's, further renewed. So as of right now, it's been renewed up to 2021 through 2022. So we'll have up until March 2023. And that's when, either President Biden will continue it again, or it could be terminated, but also, any date prior to that, either by the president or joint resolution of Congress, it can be terminated anytime. So this is something that in theory, tomorrow or, in a week or so, or whatever it might be, could be terminated. And that's just something that, plans will have to adjust to based on, what that time frame is. And, the specifics to group health plans on what is exactly kind of tied to that, it's the extension of certain election and notice deadlines. So that's a rule that was passed a couple years ago now. And that's going to be for the extension of certain notice deadlines. And that's going to be for the election of COBRA period, COBRA premium payments, COBRA notices from employers. That'll also go toward, HIPAA special election periods, and then timeframes for filing claims, appeals, and then external review. So all those things are kind of being, told right now based on that rule, and that's tied to the national health emergency. The important thing to note is that the rule does clarify that there's like a 60-day period beyond the national emergency. So the extension and the timing will still extend beyond that 60 days. So it's not necessarily going to be, if the national emergency ended tomorrow, there's like immediate action needs to be taken, something like that. There's still going to be an extension there, but it's just important to consider that, when that does change, that's going to be a major shift, plan document wise, yes, but also in the way plans are administered and the way those kind of deadlines and election timelines, stuff like that is going to be calculated and administered. So super important to kind of keep your ears to ground on that and understand when that's going to happen. So, that's kind of a lot of information, but, the thing to think about is just, what does it all mean? And I think, really what Kelly and I just wanted to get out of this and make sure was kind of, thrown out there and make sure that everyone's kind of aware of it is, Yeah, the president did say that, the pandemic's over, but, at the same time, nothing's really changed, from our perspective, from the, group health plan perspective. All these requirements are still in place. They're tied to these statutory, emergencies, national emergency and public health emergency. And until those things change, then, no change needs to be made from a plan document perspective as it relates to COVID-19 or anything like that, and the administration of these types of claims and plans and stuff. So we'll keep our eyes out, if any of these things do change, if we catch wind that, that 60-day notice does come in at some point or anything like that, obviously, we'll make our updates that we need to. We'll get in a good place to make sure that we can, help out with any kind of changes from a plan document perspective or administration of plans, stuff like that. But just the other thing to consider too is, from a plan layer's perspective, while these things have been in place for a long time, we review plans every day here at the FIA Group, and they don't all account for COVID, right? So, if you access our PDM service, for example, we have, amendments, and it's available within our template materials. It's also available for purchase through, our consulting service as well. But it's just always important that these things need to be accounted for in the plan document. Want to make sure that plan administrators are handling them correctly. And that's really just something that's important to remember, especially as, we inch closer, who knows when it's going to be, but to kind of, whatever the end of the pandemic might look like, and the end of these kind of national and public health emergencies.
And that's, those are all great points, Kevin. And, as a reminder to everybody, if they don't know it already, we're obviously here to help. If you have a situation where you're not sure how to count the deadlines, or somebody comes to you and says, hey, I had a baby 6 months ago, but I want to add them to the plan, I think I can still do that. If those questions come up, we are here to help. We are here to walk you through those situations and figure out if somebody's complying with the timelines and the extension. Now that we've been in this situation for about 2.5 years, there's a more clear cap on how long those extensions have and can go on. So it's here, and that's again goes back to our mission as a company. The FIA Group's mission and our vision is to reduce the cost of healthcare through innovative technologies and are using our expertise to help and make healthcare more affordable. And COVID is really scary in that regards, because there's been a lot of studies out there about the comparison now of regular COVID claims to long COVID claims, and the percentage of increase of the cost spend. It's scary. It's a lot. These costs are definitely going to continue to rise as more important people are impacted. So it's not time to take the foot off the gas pedal. It's time to continue to prepare and plan, because planning ahead and being proactive is one of the best things employers can do. That's a lot of the cost containment strategies that we talk about are all dependent on being proactive. It's putting them in place before you need them so that they're there when you need them. So again, we're here to help. We're still navigating these waters that are a little bit scary. And again, don't always take everything what you hear at face value, because words sometimes can just be words and aren't necessarily a change in the rules. So it's important to wait for those actual changes that come down from the administration and from HHS. And when those rules change, we're here, we'll let you know, and we're obviously here to help. So hopefully you all found this, interesting and intriguing, considering this is new, real, recent things that have happened and probably have created a lot of chaos, a lot of articles on the internet. So we're here to talk about it. If you have more questions and concerns, feel free to reach out to us. And thank you again for joining us of another episode of Empowering Plans. Have a great day.
Thanks, guys.